Welcome to Hope for Med.
Hope for Med.
Hi, everyone. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Olabunmi Agboola. She is a triple board certified physician who specializes in allergy/immunology, internal medicine, and pediatrics. She is the owner and medical director of Ilera Allergy and Asthma Center in Washington, D.C. She strives to provide quality care and treatment to every patient. She completed her medical education at the University of Illinois at Chicago and fellowship at Duke University. Dr. Agboola also founded the organization TPC, which stands for the Physician Collective, an online physician advocacy and professional social platform. Welcome to the show.
Hello, I'm glad to be here.
So, Dr. Boomy, please share with my listener your origin story.
Oh, goodness. I think it might be a little easier to kind of talk from the origin story of like why I became a doctor and how that kind of plays as well. Because it started very early on. Like I wanted to be a doctor since I was 4 years old, since I saw my own pediatrician. And I was like, oh, I want to be just like her. And I just had some great doctors growing up. So I just happened to be like really gifted at science and math growing up. So that definitely helped make things a lot easier that I'm not fighting against some talents that I may not have because we're all gifted in our own way. I was never really a big maybe sports person or something like that, but the other people may be. So we all have our talents. So mine was science and math and just the love of the human body and things of that sort growing up. I grew up in Chicago. We later moved to the southern suburbs when I was like about 7. Pretty much lived out there all the way up until like I left for college. And then I went to the University of Illinois at Urbana-Champaign, which is just 2 hours away from Chicago, 2 hour drive. And then I went back up to Chicago to go to medical school at the University of Illinois at Chicago. And I also stayed at the hospital system associated with the med school for residency. And then I later went on to Duke University to do my allergy and immunology fellowship. And shortly after fellowship, I got a job up in DC. So that's what brought me to the DC area. And I decided to call this place home for now because I really do love this area. But, in my journey, of course, you encounter different things, meet so many people from all over the world because in the journey, I've done research, summer programs away, stuff like that, which just I feel like contributed to my full growth as an adult and just all around like what I like to call a worldly citizen and different adventures and things of that sort of stuff. It's been a long time coming. I finally feel like I'm at a point where I continue to grow professionally, but now I'm gearing things more so to what I want to do and what I really, really want to contribute to society, not only with my profession, but outside of my profession. So
Well, I'm interested to know more about what it is that you want to do and what you want to contribute to society.
Oh, I know. It sounds like it's such a broad thing. I want to contribute to society, right?
How are you going to change the world? Please
Oh
share.
my God, change the world in so many different ways. So I'm starting my own practice. It should be open March 1st. And main reason for doing that, not only to service my patients, but then to really be able to serve communities that may go overlooked, especially in DC. There's a high rate of asthma, as like they like to say, in urban quote unquote communities. So really making sure that they're getting the best, like even above standard of care to make sure that we are handling that and people who look like me are really getting the treatment that they deserve. And then also being able to do more community outreach, going to speak at like schools, going to small community programs, churches, stuff like that, in which I can really try to educate and people can see you firsthand. Like they can see you, they can talk to you, they can ask questions. Because I think that really means a lot to people who don't get that very often. I think as physicians, we're also seen as being in like this high and mighty place in this ivory tower that no one can reach, no one can relate to, no one can talk to. And I think that also does a disservice in which when if we have that type of reputation and we allow other people to tell our stories for us. And then, so that's why I'm not surprised at all of the distrust that some people have developed for the medical community as a whole, because we've let the narrative go too far to where only the bad stories get highlighted and told, and patients experience difficult situations and when they're encountering the healthcare system. So there's so many aspects that we can do. And then also, I think it's really important for me trying to help other physicians who have that same vision, who want to see more physician and patient relationships grow and communication, and not to get too bogged down by all of the burdens that we have in medicine. Like, so if we're finding that we're having a lot of burnout or moral injury, and even in some cases, I'll even say abuse, how do we, just because we decided to choose this as our profession, how do we alleviate those barriers so that we can go back to the fundamentals of why we even did this? Why was it when I was 4 years old, I was like, I want to do that. It's either I'm a physician or bust. So I had no plan B.
Mm-hmm. Since the
So
age of
what
4,
would
that's
happen?
amazing.
I had no plan B. I don't even know what I would
No,
be
plan
doing if
B
I
was
had a plan
bust. You
B.
had a plan B.
Oh yeah, a plan B. I mean, I probably would be on my mother's couch right now. So
Mm.
that was probably plan B. But I just think there's just so much more that we can do. I've worked for different hospital systems. And when you look at those contracts, they're very limiting in some cases, in which doing some of the community outreach you might want to do always has to be affiliated with your workplace versus affiliated with you. And I feel like we as physicians are our own brand, in which we carry that name in our reputation as well, that you can affiliate it with your workplace, but there's just so much more that we can do if we aren't restrained in some sort. And so, yeah, I like the fact that I'm going into a private practice. I hope it does well. I'm going to work on it to do well.
Mm-hmm.
But I just feel like it opens up a lot of opportunities for me to fulfill those goals of just anything's possible. And the main thing centering around the physician and patient relationship.
Well, you mentioned so many things that are really important and important for me to highlight. And one of which was you mentioned burnout and moral injury.
Yeah,
Do you feel like moral injury is a bigger concern now than it was before?
I do. I do. I feel like with moral injury, it almost creates a feeling of just being disheartened about why you chose your profession. Why did you make all those sacrifices for all those years to get the, most knowledge to be able to treat people in a way that we're not just doing any old thing to people.
Mm-hmm.
Like, there are reasons behind why we choose certain medications and things of that, and treatments and stuff like that. So we spent all those years getting that book knowledge, getting that tactical knowledge, and why we do our residencies. And then to go out into the workplace and be treated like a number, to be treated like a hamster on the wheel, and for people not to really care about you as the physician. Like, you're just supposed to just chug in and chug out. And that is not why most of us went into this. Most of us, and from what I find, most of us went into medicine because we truly have a genuine care to help people. And how do we tap back into it? Like, I really hate it when I see a really good physician who just got burnt out by the system, whether it was just too much administrative work or they couldn't get the time off to really deal with the whatever personal issues or family issues they may have going on, because we're not genuinely looking at them as a person who has flaws. And that is dangerous. And that is sad, because it takes so much to make a physician. So we shouldn't want to see physicians leave the practice in medicine, especially when there's so many people who need our services. So how do we balance or make things better to where we can keep physicians, or how do we transition physicians? And that's really what PPC will be focusing on, because moral injury is not just usually one thing, is a multifactorial system to me that creates an environment that makes people either want to quit. Unfortunately, some may take their lives. Some may have a mental breakdown. Sometimes it exacerbates mental illnesses. And we also have to consider that as a factor too. So,
So, what can physicians do to battle some of these challenges?
I will ask most physicians to really look at themselves and really find out your why. Why did you go into this? And if your why is really in tune with the care of people, then how do we get you back to that? So kind of starting with your why and then fostering an environment in which your why can flourish. So for some physicians, depending on what career field they chose, we will have to like kind of figure out what is best for them. For some docs, maybe it's something as simple as going down to part-time. For some, it may be leaving academia and going private. For some, it may be going to stop taking insurance and going into a direct care type of practice. So I feel like there's many ways to work around where you can still practice your profession without having some of the time limitations, if that's a concern. If it's time off, then asking for that or seeking that, getting that, or even having to leave medicine for a while and then coming back, that could be a solution. Like I do feel like there's several solutions out there. Um, they may not be popular solutions, but there definitely are solutions. It really depends on the why and what is the main cause of concern that makes them feel like they're having that that feeling of burnout or moral injury. Because if it really is a toxic workplace environment, how can we undo that or how can we address that? So starting with the why and trying to go find a solution from there.
And have you experienced any symptoms of burnout?
Oh yeah. Oh, absolutely. And I wasn't even a practicing physician at that point. I was still in training, honestly.
Mm-hmm.
I felt like I kept going, like from undergrad all the way until like I finished the clinical part of my fellowship. So I did an allergy fellowship, which is typically 2 years. So I did board certify after 2 years, but I stayed on an additional 2 years to do research just because I needed a break. Like I now
Mm-hmm.
before I went to go and practice, I needed a time out. So what I ended up doing was doing research, which I loved. But then I worked as a locum hospitalist because let's just be real, bills have to be paid.
That's right.
Um, so, but I really enjoyed it because even though my research paycheck wasn't that much, but it was enough to keep the lights on, having a little bit of extra income, doing locums and working contracts where I can choose my schedule, whether I do 6 shifts a month or 14 shifts a month. And these would be 12-hour shifts. So there was always like I could go home and rest and be left alone. But I definitely did not want to jump back into a controlled environment in which someone was telling me where I had to be, when I had to be there, and blase, blase. Because right after fellowship, I did think about going the academic route. I was offered an academic position, but for me at that point, it really wasn't worth it. With the research I was doing, it did well, couldn't get funding for it to see it all the way through. And in order to continue to try to get funding for your research, a lot of times, if you don't already come with that funding, you're likely going to have to pick up clinical work until you can get funding for whatever project that you're doing, whatever research that you're doing. And I just decided, like, you know what, that's not the route I wanted to take. Like looking at the contract, it was very demanding on my time. The salary was low,
Mm-hmm.
um,
Mm-hmm.
very low. It was lower than what I was making working 9 shifts a month. I was making, when I worked 9 shifts a month as a locum, I made double what they were offering me.
Wow.
So that did not help at all. I was like, wait a minute, this salary.
They're probably trying to offset it because locums, you don't have benefits, right? And so salaried position,
True.
maybe. But that doesn't equate for double. No way. But go ahead.
Yeah, I was making double working less, and
Mm-hmm.
I'm like less than part time, and I'm making more as a locum, and for the academic contract, that's doing clinics 4.5 days a week, doing call teaching, and then trying to get your research established. That's a lot. I knew right then and there. I said absolutely not, because for me it kind of gave me a visceral feeling of when I was a fellow, just trying to keep my head above water. I had so much going on, not only the demands of my time because of fellowship, but then also had a few personal things going on as well. So I was like, I do not want to go back to that place at all.
Mm-hmm. Yeah. Something that you mentioned was that burnout started early. And did you say undergrad?
No. I said like I started to experience small bits of it
Uh-huh.
since undergrad.
In undergrad. Okay.
So
Mm-hmm.
after basically going from med school and up.
Got it.
So, and I realized for me, what made me the most unhappy and what made me want to pull away from my why was the demands on my time. Now, there's some, like, I had to deal with it in residency. You don't have a choice.
Mm-hmm.
So I just dealt with it the best that I could, but I was not my happiest. Like right now, I'm my happiest. So that's a big factor for me. So finding out what, really tapping into my why and what's keeping me from really being happy with achieving my why
So how
was the
did you
way I
figure
dealt
that
with it.
out? Like, how did you figure out of all the other things that it was really the time constraints for you?
I think it came later. I think it was an accumulation over the years. I started to notice that I dreaded going to work.
Mm-hmm.
I dreaded going, even though, like, I mean, I would, I would just like almost be like angry the night before. Like, especially like if I knew it was like one of my long weeks, because at that time we did Q4 call, because it was right at the time that the like no more than 16 consecutive hours or something like that for interns took place. So like that was like, because I was med peds, we had a 16-month internship, so I got to experience some of that. But when we were on Q4, and you know how you have your long weekend where you're
Mm-hmm.
working that Monday through Friday, you're on call Saturday, off Sunday morning just to go back Monday
Yep.
morning.
Yep.
Oh, that was a killer. I would be so angry. Or when I had my golden weekend and a Sunday night, and that those feelings came back again. And it wasn't that because I hated my job. Like I hated work. Like I actually really like working with the patient. Now, I'm not gonna lie, I wasn't a big fan of night shifts, but but I did actually like patient care. But those inpatient months when the time constraint was really intense, I was always in a place of just survival. I really can't even say all the way how I survived it. It's just, I just did it. I just kind of like tuned everything out and just did it. Like I just slept when I could and just went to work. I became a zombie, honestly.
Mm. And you didn't want to continue being a zombie after.
Yeah, I said, and I think that's the reason they do them in rotations and try to space them out some,
Mm-hmm.
because you can't do that to a person back to back. You just go crazy to me.
Mm-hmm. Mm-hmm. So this is your first venture out into private practice?
It is.
And what are your thoughts around that?
I like challenges. I think it's definitely my next challenge. I feel like I've done a lot in my medical career so far that I've wanted to do. So I've done research and worked in a private practice group setting, and now really venturing out on my own. This way I can, you know, put to vision the things that I would like to see, how I would like to see a clinic run, and the ideas I have around the clinic, and also centering that with the surrounding community as well.
And could you tell me a little bit more about the work that you do with the Physician Collective? I know there's an emphasis on physician advocacy.
Yes. So, kind of like what we were speaking about before, moral injury being a big concern, a lot of physicians were really felt this sense of moral injury, and some even experience what I like to call just plain abuse of their labor during the times of COVID, whether it be you're not needed, you're kind of disposed like garbage because maybe you do elective surgery, and right now the hospital doesn't feel the need to support you, even though you have a mortgage and a family and this and that and the other going on. So it really made a lot of physicians look at themselves, look at what they contributed to the profession, and have second thoughts like, if they could just treat me like garbage, then why did I do all of this? And like I said, the main goal is like, I want to see good physicians continue to be good physicians, like to retain good physicians. Absolutely. That's like one of the main things. And I think the way to go about it, and the reason why I called it the Physician Collective, is that we as physicians don't talk as much as we should. We don't, I would feel like we should communicate more. If someone has like with me starting this practice, I got help from several of my colleagues. So really creating that social platform where someone can really reach out and get really good advice on things that they're pursuing, whether it be an employment contract, looking to do locums, maybe opening up a private practice right out of residency, whatever that they may need help on. And I think that will also feed into their why and help with that moral injury part, because they really understand their why and they understand why they're working. Because one thing I do find is that people don't mind working hard, especially if they're working towards a goal, especially if they're working towards maybe even their own goal. Like I don't mind the fact that I may work long hours with this clinic because my why is even bigger. You know what I'm saying? I think with the Physician Collective, if we have the advocacy platform that we need to try to legislatively put in either different bills or try to challenge what's already on the books to make physicians' lives easier, more efficient, and to maybe even put a halt to some of the misuse of us and our credentials. I think that would help a lot. I also do one thing that I did find when I started the Physician Collective is that a lot of physicians didn't feel that anyone was really representing them or really spoke towards their voice of concern. So, yeah, the Physician Collective kind of started off with that idea that we would come together, work together towards the goals that we think would help us as physicians practice, keep that physician patient relationship intact and grow, versus like having all of the outside forces that kind of pull us away from that. So this way we can get back to our why.
Hmm. So you mentioned that we are, we as physicians are not necessarily the ones that are sharing our narratives. So who is sharing the narrative for us or on our behalf?
Everyone else,
Mm.
this is how I know we're not basically showing our own. Like, I don't know if you ever like noticed that the biggest news stories, and I think that's kind of across the board. People don't talk about the good things. Like, if you watch your nightly news, they might have like one feel good segment, but then everything else is like all of the bad stuff going on in your local city. You're like, oh, I don't want
Hmm.
to go over there. Oh, this
Yep.
happened. Oh, they got shot over there. Yeah, I don't want to go. There was a carjacking or a train wreck. It's just like you hear all of the bad stuff, and I understand. I mean, that's marketing. That's what people hear. That alerts people and gets their attention. But it has painted a narrative to where people are like, well, I don't trust physicians. They're all just in it for the money, or they're getting pharmaceutical dollars and stuff like that. And yeah, maybe some, but I think the majority of us are in it with good faith.
Mm-hmm.
Um,
Mm-hmm.
and that's not highlighted. It may be highlighted in your newsletter with whatever company you're affiliated with, but that's usually about the limit to as far as it goes there. So I think creating a platform where we can talk to each other, talk with our patients, put out the information that we would like to see and put out. That's why, like, even going back, I think if patients trusted us more, COVID probably wouldn't have been as big of a mess as it was. A lot of it, yeah, it was distrust of the government, distrust of the medical physicians. We were yelling, like, please get vaccinated, please get vaccinated. And people were like listening to, why should I, like, looking at us like, why should we listen to you? I mean, even though like Ben almost dying and they come to the hospital, which is also an oxymoron to me, but I'm like, this is crazy. And I'm like, it started a long time ago. Like, we don't control the narrative. And I think part of that is driven by outside forces, people who are looking to monetize
Mm-hmm.
off of painting physicians in a bad light. Now we have a lot of, I wouldn't say bad, but interesting career paths of alternative medicine that I've never heard of. Like, I've heard of acupuncture and stuff like that, but I see like on social media, like people doing things that they say are do to treat certain medical conditions. And I'm like, oh, so we're basically back to where you can sell snake oil, it seems like. So all of that to me is just related. It's all related.
Mm-hmm. Mm-hmm.
Our image and our reputation is related to how the public sees us. And I understand why some patients have concerns. Absolutely. You shouldn't just listen to just anybody and say, yeah, I'm just going to believe everything you say 100%. But, I do ask patients to critically think about where their information is coming from.
Mm-hmm. Mm-hmm. So, what can we do to take back control of the narratives? I know that one of the things you mentioned in the beginning, depending on where it is that you're working, it's hard for you to go out and do anything because you're linked to your place of employment.
Yeah, I say join the physician collective. Our membership will launch pretty soon. We're working on the website now to be able to support membership. But basically, I mean, physicians are busy. We should be busy. We should be busy doing our why, seeing patients, interacting with patients, or research, or whatever it is that drives us. But the monetary contribution, although very small, as a collective will help us basically advocate and lobby for physicians' behalf, be able to put out more stories about what we as physicians do, kind of change the narrative in the public view, and so much more, and also helping each other thrive. So there's going to be plenty of resources there for whatever type of physician you are, whatever type of practice pathway that you took, whether it's private, locums, employed positions like that. And then there's things so we're transparent, like our voting system. So people will be able to vote on the things that we decide to advocate for versus like you're putting money in an organization and they're just advocating for whatever they want to advocate for. And it may not be to your benefit. And I think that's what some of the concerns that physicians have about other organizations is that they feel like they're paying, but they're advocating against their interests. So I'm like, well, that's a little, crazy. So no, it's stuff that we want to see, we want to happen, we want to have bills introduced into Congress. It's focused on us, but it's focused on us too, so we can get back to doing what we really, really went into this profession for.
Mm-hmm. Mm-hmm. And who can join the physician collective?
Residents and above. So residents, attending, fellows. Initial membership would be 125 for attending, 75 for residents or fellows. So very small contribution. And it really is just helping us, one, to keep the web platform going, hire the staff that we need to hire that's going to go over on Capitol Hill and make a fuss on our behalf, because obviously none of us can take off work and do it. Some of us can, some of us can. And also engaging the physicians who want to do that type of work. And it's so hard to know what's going on in one state versus another state, because a lot of the things that affect us, it usually started off in one place and then it happened over time like a monopoly. And by the time it may get to you, you didn't even notice that it was something that started long ago and it was used as a way to be introduced in another state. So things like that, we're keeping surveillance on different bills that are being passed and stuff like that. I think it's not going to be easy, obvious, but all we can do is try. That's all we can do is try to make the environment of practicing medicine better. So hopefully we can take away from some of the more injury that some of us are experiencing. Like things that I would like to see, I would definitely like to see a mental illness diagnosis not be used against physicians who are stable and able to practice within safe boundaries. I feel like it's a shame that so many states bar physicians from practicing just because they may have a diagnosis on the record, or they have to continue to prove that they're better. Maybe they just had a moment in their life where they may have experienced like deep depression or something like that, because we have such high suicide rates. And I feel like part of it is because we're afraid to really seek the help that we need.
Yeah. And there's no outlet to be able to talk about it. So you just keep it inside and then you just feel
Yeah.
isolated and lonelier.
Yeah.
So that's what these conversations on this podcast is about, to really share these stories and let people know that they're not alone, they're not
They're
isolated,
definitely not alone.
and that they're human. We're human.
We're
Constantly remind
human.
that, right?
We're humans who just chose a profession. That's it.
That's it. Not heroes. Not heroes.
Absolutely not.
So, if my listener wanted to find out more about the Physician Collective, where do they go to find out more information?
I would say go to our Twitter page. It is the PhysPhys Col COL1. We have a Facebook group, but I understand everyone's not on the Facebook group. But if they follow our Twitter page, they'll be updated on the new website. So the old website that's there now, that'll be taken down. So don't even bother. But the new website will be up in a few months, and then they can join that way. Because I do know that like there's several physicians who don't have Facebook. I think we're very active. We're about 26,000 physicians on the Facebook group, and we hope to turn that to an official organization. That's where the website, will take place. So people from outside of Facebook can obviously join. And yeah, follow us on Twitter. And if they're not sure, just check for in a few months. And with the SEO optimization, hopefully Google will put us up there so we can easily be found. Because we'll definitely advertise for sure.
Awesome. All right. So I think that the work that you're doing is absolutely amazing and it's so needed.
Oh, thank you.
So
I have a great team. So I would say a great team of physicians to help with trying to bring this vision into fruition. So I definitely can't do it alone.
mhm.
And again, that's what the Physician Collective is about us coming together in a systematic way, because we don't want chaos, but that's what that social platform will be. So we can actually get things done that help us all.
So in closing, Dr. Bunmi, do you have any pearls of wisdom that you would like to share with my listener?
Yes. And this could be for anybody. We have one life to live. Understanding what drives us in our lives and what we really care about and care for. We should pay attention to, give to, and definitely seek out our why. I love that. Just basically seek out your why and kind of go from there. We're not perfect. All we can do is try. But when you know your why, I think the way life falls for you starts to be almost ordained by whatever you believe in. So definitely, definitely understand your why.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.